Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How many years should you take Prolia? How long can I stay on Prolia for? For Prolia to work well at reducing fractures, it needs to be taken long-term, and in one phase 2 clinical trial it has been used safely for up to 8 years with substantial increase in bone density, although most clinical trials are for 3 or 4 years. Does taking Prolia injections longer improve my fracture risk? Prolia reduces the number of new vertebral fracture in postmenopausal women, and the longer it is taken shows there is a bigger decrease in chance of vertebral fracture. In the first year the Prolia group has 1.3% less fractures compared to the placebo group. In the first 2 years the Prolia group has 3.6% less fractures than placebo group. In the first 3 years the Prolia group has 4.9% less fracture than the placebo group. Percentage of women with fractures. Treatment time. Prolia group. Placebo group. Difference between groups. 0 to 1 year. 0.9%, 2.2%, 1.3%, 0 to 2 years. 1.4%, 5.0%, 3.6%, 0 to 3 years. 2.3%, 7.2%, 4.9%. Related questions: what's the difference between Prolia and Reclast? Does Prolia weaken your immune system? Does Prolia cause weight gain? When should I stop Prolia? It is important that you should not stop Prolia without discussing this with your healthcare professional. Stopping Prolia can cause an increase in the number of multiple vertebral fractures, often within a year of stopping. The reason for this is once Prolia injections stop, there is an increase in bone turnover and rapid bone resorption. When stopping Prolia, your healthcare profession may recommend you to take another osteoporosis medicine to prevent the increased risk of multiple vertebral fractures, due to the rebound increase in bone turnover. Bottom line: there is no recommended time of treatment for Prolia injections. Clinical studies have often been 3 years, and at least one study went for 8 years. The longer you take Prolia injection, the bigger the improvement in fracture risk when compared to placebo. Stopping Prolia injections can cause a rebound increase in bone turnover, which increases risk of multiple vertebral fractures. Do not stop taking Prolia injections without first discussing this with your prescribing health professional. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.